Hey guys, it's Nurse DJ. I actually received some questions from about two people, and one of the questions I wanted to acknowledge today was regarding my journey into nursing. And I know that's a video that a lot of people usually do when they start talking about nursing school, so I can definitely do that for you guys. So I guess I should start with um, high school, really. I always knew that I wanted to go into healthcare, and from an early age, I my first love was becoming a doctor. That's what I wanted to be. And from about elementary school, um, I had to go to my pediatrician a little bit more often than a lot of my friends because I have ADHD, so I had to go 4 times a year for checkups for that. And I thought my pediatrician was really cool. I wanted to be like him. I wanted to be in the hospital. I thought the hospital was really cool and everything. So that was my goal. And he kind of inspired me and told me, you can do it, keep up your good grades. And so I did. In junior high, I graduated third in my class, well, middle school, and then in high school. I was an AP student, graduated with honors. I was drum major of my marching band, and la da 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 da. That was a lot of stuff that I did then. But the important stuff, the health related stuff that I started doing, started the summer before my senior year of high school. And um, I volunteered with the hospice and home health care office for the local hospital in my hometown. And that was pretty awesome. I mainly did administrative work, which was cool, but I did get to call doctors' offices and speak with them to make sure that appointments were scheduled and make sure that the patient was understanding the plan that the physician had for them. So I would call the patient after I called the doctor's office and kind of act as a middleman between the two. And I did that for the whole summer. I actually got paid a stipend for that, so it was more than just volunteer work. And then, um, senior year came and I graduated, and then I went to college. And at that point, I was still pretty sure that I wanted to go to medical school. I was gung ho medical school. So I decided that I want to major in biology because I always liked science. And did really well my first year of undergrad. I had a 3.7 GPA. And then the summer after my freshman year, I did a health medical internship, really. I got to go out to Des Moines, Iowa. I know, Iowa, yeah. To an osteopathic medical school. And there for 4 weeks, I learned about physical therapy, osteopathic medicine, physician assistant studies, and and podiatry. So I learned about that. All that was really cool. There was no nursing. I didn't learn about nursing then, and that's one of the issues that I'm going to bring up. But okay, and then came back sophomore year, still did really well. And then my second summer, I volunteered in the hospital some. I did another health related internship and really enjoyed that. And then, let me go back to freshman. Let me try mix my volunteering in because I was in the honors college at my university and we're required to do volunteer hours. But I wanted my volunteer hours to be health related because that's the field I want to go into. So starting freshman year, I volunteer at the free medical clinic that was in my town. And the free medical clinic was run completely by RNs and nurse practitioners. There was about 2 nurse practitioners, a few RNs, and I believe there was an OPN there as well. Now, my job as a student volunteer was a little bit different. It would have been a different experience if I was in nursing school and I was volunteering, but because I was a student with no clinical training, I kind of did more